germinal center B cell marker, CD20 marrow pre-B cells after CD19 expression, and mature B cells also express CD20. طيب هون عندنا CD34. It's a pluripotent hematopoietic stem cell marker. Okay, it's a marker of progenitor cells of many lineage. CD45, the other name is leukocyte common antigen, LCA, so expressed by all leukocytes. It's a common antigen to all leukocytes. CD45. Right, let's start with acute leukemia. The definition of acute leukemia, it is malignant clonal expansion of hematopoietic cells associated with early stages of differentiation, characterized by poor response to normal regulatory mechanisms, decreased capacity for normal differentiation, and growth advantage over normal hematopoietic cells. Proliferation of cells with a block in differentiation. So we have block in differentiation in acute leukemia. At what stage? At early stages of differentiation. لأنه بيكون المين cells proliferating from many blasts, which are primitive cells, or early in the differentiation of the lymphocytes, blast proliferation. Like this differentiation arrest results from acquired mutations in specific transcription factor. So we have mutations in transcription factor needed for the differentiation of immature lymphocytes or myeloid progenitors. Okay? بصير في عنا mutation ب transcription factors needed for the differentiation. With addition of other mutations that allow the tumor cells to proliferate in growth factor independent fashion مثل أي neoplastic process. بيكونوا الtumor cells ما بيستنوا growth factors to proliferate. بيكون في عندهم independent proliferative capacity. تمام؟ طيب. Regarding etiology of acute leukemia, it is a combination of predisposing factors, genetic factors, and environmental factors like chronic exposure to chemicals or radiation exposure. اللي هم هذول environmental factors. Manifestation of acute leukemia mainly related to the replacement of normal hematopoietic elements in the bone marrow. Okay, the bone marrow is replaced by clonal expansion of blasts. So the normal hematopoietic elements are suppressed. So we have paucity of red cell production. The patient will have anemia, and the symptoms related to anemia from fatigue, pallor. Tamam? Platelets, we have a drop in platelet production, thrombocytopenia. The patient will experience bleeding tendency. And the normal white cells also are suppressed or decreased in number. We have white blood cells when we do CBC, but all are blasts and abnormal. Okay, so normal white cells are decreased and the rate of infection increased. The patients will present with infections and fever. Presentation, acute leukemia present abrupt, okay, and acutely. Clinical signs حكينا related to suppression of bone marrow, fatigue, fever, bleeding tendency, bone pain and tenderness due to marrow expansion by blasts, lymphadenopathy and organomegaly, lymph node enlargement, and organomegaly spleen and liver enlargement, which is seen more in ALL, اللي هي acute lymphoblastic leukemia rather than AML, acute myeloid leukemia. ALL, we see lymphadenopathy and splenohepatomegaly more. Central nervous system manifestation due to meningeal spread and involvement, The patient will present with headache, vomiting, mainly seen in children with ALL more than AML. Skin and gum infiltration. This also seen in acute myeloid leukemia M5. By the end of the lecture, رح نحكي عن the types of AML. طيب. Diagnosis of acute leukemias. Of course, the simplest steps أو tests اللي هم peripheral blood smear and peripheral blood film. Bone marrow examination is crucial and essential to see the blast infiltration, okay, in the bone marrow. Immunophenotyping using the immunohistochemical stains on biopsies, histopathological biopsies, plus also flow cytometry, cytogenetic and molecular studies. Type. Prognostic factors affecting the outcome of leukemia. Of course, tumor type, which type we are talking about, رح نشرح عنهم. What the stage of this tumor, genetic abnormalities, some of them are favorable prognosis, others are poor prognosis, associated with poor prognosis, patient age at presentation, what response to therapy, tumor that shows a good response to treatment after therapy drop in the blast, giving a good indicator that the patient will respond to specific treatment, chemotherapy, okay? إذا كان response to therapy poor or not remarkable, this giving an indication this gonna be a tumor with a poor prognosis. Regarding the laboratory findings, peripheral blood, we will see blast, peripheral blood smear and blood film. We will see the blast circulating, okay, will smear. CBC, high white blood cells, most of the time. Anemia and thrombocytopenia, حكينا due to suppression of bone marrow. Bone marrow aspirate and biopsy will show hypercellularity in the vast majority of cases, most of the cases. This is the biopsy of a normal bone marrow. Normal bone marrow is a fatty cellular tissue, okay? عبارة عن fat globules, in between we have the hematopoietic elements. This is the normal bone marrow, okay? And this bone trabeculae. This is normal. The abnormal, you can easily tell that we have hypercellularity and cellular infiltration in the bone marrow. Epidemiology of acute leukemias, 1/3 of cancer in children, mainly acute lymphoblastic leukemia, lymphoblastic, ALL. ALL is a childhood disease with about 75% of cases under the age of 7 years. AML, acute myeloid leukemia, is an adulthood disease with median age of 50 years. ALL, it is an acute or malignant clonal expansion of immature lymphoid cells, lymphoblasts. Immature lymphoid cells are lymphoblasts, involving the bone marrow, blood, and may involve the lymph nodes and extranodal sites. If the bone marrow is infiltrated by more than 20% of more than the bone marrow is lymphoblast, then it is what? Leukemia. However, the lymphoma, if you have a mass lesion and less than 20% lymphoblast in bone marrow or blood. يعني ممكن يكون عندنا acute lymphoid lymphoblastic leukemia or acute lymphoblastic lymphoma. Based on what? On this cut point of involvement of the bone marrow or blood. We have blast more than 20%, then this is leukemic picture. Type, lymphoidoneoplasm, acute lymphoblastic leukemia, of course it could be B type or T type. ALLB or T type. Type. This picture shows a peripheral blood smear. Here you can see the red blood cells. And here we have large cells with what? With large
I answer.
nucleus,
لا صوت.
condensed chromatin, minimal cytoplasm, تمام? A granular cytoplasm, ما في granules, and inconspicuous nucleoli, مش واضحين. Inconspicuous, okay? These are lymphoblast. رح نعمل مقارنة مع الميلوبلاست, myeloid progenitors أو precursors. طيب, ALL immunophenotypic classification in ALL is useful in subtyping into B ALL or T ALL, and to differentiate ALL from ALL based on the immunophenotype expression. طيب, حكينا الاميونوفينوتايب ممكن نوصل له عن طريق الاميونوهيستوكيميكال stains on biopsies or flow cytometry. The BALL, which is about 80% of childhood ALL, they express CD19 and TDT, the main two markers. TALL, T lymphoplastic leukemia, CD2, CD7, TDT positive. What is TDT? اللي هو shared by both B and T cells. هو عبارة عن terminal deoxynucleotide transferase enzyme expressed by pre-B cells and pre-T cells. So بيفرق ال TDT ال ALL عن ال ALL. تمام؟ طيب. BALL usually manifest in bone marrow infiltration. مثل ما حكينا بداية اللكتشر, where B cells precursors normally develop, and also present in infiltration of the peripheral blood as leukemia. Peak age of presentation 3 years. TALL present as a mass lesion involving thymus, which is the normal site of early T cell differentiation, present as lymphoma because it's a mass lesion. But also, it may progress, or at the time of presentation, present in a leukemic picture with blast involving the bone marrow or peripheral blood more than 20%. Peak age of presentation, اللي هو adolescent age, 15 to 20 years of age. Peripheral blood, the same as the acute leukemias, ALL, عبارة عن circulating blast, anemia and thrombocytopenia. Bone marrow is hypercellular with sheets of blasts. Regarding genetic and molecular studies, 90% of ALL have non-random karyotypic abnormalities. ALL, B lymphoplastic leukemia, shows hyperdiploidy. شو يعني hyperdiploidy? More than 50 chromosome per cell. Normally هو 46. Hyperdiploidy more. Translocation 1221. Adult type B ALL, about 25% shows translocation اللي هو Philadelphia chromosome 922 with ABL BCR gene fusion. Okay? TALL, 70% of TALL having a gain of function mutation in what gene? Not one gene. So, regarding prognosis, حكينا factors giving a favorable outcome or favorable prognostic factors. When the white blood cells at time of diagnosis less than 100,000, it is worse, it's good prognosis. More than 100,000, poor prognosis. The age, between 2 and 10, good prognosis. Less than 2, more than 10 years, worse prognosis or poor outcome. Gender, female is better than male gender. Blast, the B cell type, يعني BALL is better than TALL in terms of prognosis. Karyotype or molecular findings. Hyperdiploidy is a good prognostic factor. Trisomy 4, 10, 17, good prognostic factor. Translocation 12 to 21 is good prognostic factor. Hypodiploidy, on the other hand, trisomy 5, translocation 9, 22 are poor molecular findings. Okay? The course of ALL, it is rapidly fatal if untreated. Treatment includes chemotherapy and radiotherapy. With chemotherapy, 90% remission rate, while 70 to 80% cure if favorable prognostic features present. لما يكون في عنا features are good prognostic factors, okay? موجودين in the case. إيش الفرق بين الريميشن والكيور؟
الكانسر تبع الريميشن بيصير هذا مؤقت
ممتاز، صحيح. طيب نيجي على الأذر part من الأكيوت leukemias اللي هو ال AML, acute myeloid leukemia. 85% it is an adult leukemia. Median age of presentation 50 years. Most AMLs harbor a mutation in genes coding for transcription factor needed for normal myeloid cell differentiation. No simple concept, okay? نشوفه بال ALL or AML. Mutation in transcription factor needed for the differentiation and maturation of the progenitor cells. بصير في عنا arrest. طيب myeloid blasts من blasts of myeloid lineage or promyelocytes اللي هو a little bit more differentiated cell than the myeloid blast, promyelocytes, okay? Make up more than 20% of bone marrow cellular components. هيك اسمها leukemia because we have 20% infiltration in the bone marrow with myeloid blast or promyelocytes. This picture from the bone marrow, you can easily tell it is a hypercellular bone marrow infiltrated by cellular infiltrate or abnormal cells. طيب نيجي للclassification of AML. AML are diverse in terms of genetics, cellular lineage, and degree of maturation. The WHO classification based on all of these features, genetics, cellular lineage, and degree of differentiation. Regarding immunophenotype and immunoexpression of immunohistochemical stains, or let's say markers, the expression of immunologic markers helpful in differentiating AML from ALL. Myeloid associated antigen examples CD13, 14, 15, and most important one CD117 واسمه الآخر KIT marker, immunologic marker. طيب بالنسبة للclassification, the AML classified into 4 groups. AML with recurrent chromosomal translocation. Some of them are favorable prognosis, others are poor. AML with multi-lineage dysplasia, if there is dysplasia or not. If this dysplasia with the previous MDS, myelodysplastic syndrome, هنحكي عنها upcoming lectures, or without previous MDS. AML related to therapy, chemotherapy-induced AML. This is another group. And AML not otherwise specified. هلا لو كانت ال AML not associated with dysplasia and not therapy related, and for example عملنا الجينيتكس اللي ممكن نعملهم الجينيتك ستاديز وما طلع عنا ولا واحدة من ال common أو ال known genetic abnormalities. Now we divide the AML based on another system into 8 subtypes. According to the French, American, British FAB classification of AML, based on extent and type of differentiation and maturation, at which level of myeloid differentiation. وين صار عنا الارست والproliferation of which cell type. تمام؟ مش مطلوب منكم بس مطلوب تعرفوا ان الاسمه الفاب from 0 to 7 وانه هو يستخدمه لما اذا ما كان dysplasia associated with dysplasia therapy related وما في عنا non recurrent chromosomal translocations. اوكي؟ طيب هلا في certain او specific features في certain subtype. For example M2 AML M2 associated with formation of something called granulocytic sarcoma. ايش هي granulocytic sarcoma؟ عبارة عن AML لكنها tissue infiltrating. اوكي؟ مش بالبلد والبون مارو، عامل mass forming AML called granulocytic sarcoma seen more with M2 type. M3 associated with increased risk of DIC, disseminated intravascular coagulation due to procoagulant and fibrinolytic factors released by the leukemic cells. M3. M4 and M5 also infiltration of soft tissue اللي هو granulocytic sarcoma, mainly gum infiltration and skin deposits. Plus meningeal involvement, the patient presented with headache, vomiting with eye symptom, مثل ALL. حكينا meningeal spread more with ALL if we compare it with AML. لكن في عنا subtype اللي هو M4 M5 can present with meningeal spread as well. تمام؟ طيب. This is a peripheral a bone marrow aspirate, okay? It's an aspirate from the bone marrow showing myeloid blast, these large cells here, promyelocytes or myeloid blast. The characteristic of these cells showing coarse and numerous xerophilic granules where in the cytoplasm, granular cytoplasm. تمام? Also we have something called our rods. Our rods اللي هم rod-like structures. هذول اللي هم rods, okay? They are distinctive red staining rod-like structures present in myeloblast or more differentiated cells, promyelocytes. Okay? A step up differentiation, more differentiated a little bit. They are numerous and specific type of AML and helpful in distinguishing AML from ALL. And also sometimes بتكونوا characteristic في one type of the AMLs اللي هم ال 8 types. Okay? So, common cytogenetic abnormality in AML, translocation 15-17, inversion 16, same chromosome, inversion, translocation 8-21. رح نحكي specifically عن translocation 15-17. في عنا جين على الكروموسوم 15 called PML, promyelocytic leukemia gene, okay? And the gene on 17 اللي هو RARA اللي هو retinoic acid receptor alpha on 17. Translocation, this translocation will lead to what? To hybrid protein blocking the myeloid differentiation at the promyelocytic stage. So في عنا differentiation arrest من الهايبريد بروتين result from this translocation 15-17. هلا في عنا clinical application on this translocation. AML with the translocation 15-17 can benefit from targeted therapy, administration of ATRA, all trans-retinoic acid. This analog of vitamin A overcome the blockage, okay, induced by the hybrid protein produced from the translocation. Okay, ATRA given for 15-17 translocation AML. Prognostic factors of AML تقريبا مثل ال ALL, patient age, white blood cells count and presentation, if it's de novo or secondary leukemia to therapy or with MDS, previous MDS, this worse prognosis, certain cytogenetic abnormalities, like مثلا good prognostic cytogenetic abnormality 15, 17, 8, 21, inversion 16, good prognostic factors, poor prognostic factor age more than 60, prior MDS related to therapy related AML, and leukocytosis more than 100,000, and melifusion gene, poor prognostic factor. هدول كمان description للبلاست ALL و AML. شوفوا cytoplasm more with AML. Okay, here you can appreciate more cytoplasm if we compare it with the blast, lymphoblast. Condensed chromatin, hyperchromatic, more nucleus. Multiple nucleoli, more nucleoli, هدول البيلر في النيوكليوس، هدول nucleoli more with AML than ALL. Agranular cytoplasm, if you can see the cytoplasm, لو شفتوه هو طبعا ريم بيكون thin rim بالبلاست بالليمفوبلاست، لكنه agranular. The presence of our rod كمان supporting that this is AML. Yes. اوكي بس كمان شوي هناخذ حضور الغياب. اوكي تمام. طيب هون a quick comparison كمان between AML, ALL, the age, AML adult, children ALL, myeloblast in AML, lymphoblast ALL. هون اللي هو morphologic description of ALL, lymphoblast, myeloblast. The expression of immune markers, myeloperoxidase in AML, TDT in ALL, extramedullary disease with spleen liver involvement more with AML, and lymph nodes involvement in ALL. The markers حكينا عنهم also CD13, 14 AML, CD117 اللي هو الكت more with AML, وال ALL اللي هم B markers or T markers. طيب هنا case clinical case presentation. If you have patient 30 years of age presented with worsening productive cough, the hemoglobin is 10.2, which is anemic shape, MCV 31, hematocrit rate 31, platelet count 36,000, which is thrombocytopenia. Microscopic examination of the peripheral blood smear shows blasts with our rods. So most likely it is an AML, the answer. Okay? طيب أعطيكم العافية. هاي المحاضرة الأولى، خلينا ناخذ حضور غياب.
والله يعني جميل إلى حد ما. ثواني، هذا حلو الأول. رود صعب شوي.